Wait lang ha. Parang hindi ko ata nalakasan yung volume. Sige, last meeting class, we started our discussion about arrhythmia. So, we had videos last time, no? Yung videos natin on how the heart works, our conduction system. We have these following steps in the conduction system of the heart, starting from our pacemaker, which is called sinoatrial node. And that impulse created by the SA node is being distributed to other fibers of the heart. Okay, from the SA to the AV node to the bundles and the Purkinje fibers. Okay, and this one is our action potential. How our body creates our impulse is through these ions. So we have here the sodium, potassium, and calcium. So take note of their movement inside and outside the cell. Meron dyang mga parang succeeding na mga pangyayari in the cell. So everything starts here at 0, which is our depolarization. And what happens at depolarization, there is sodium intake. Okay, so the cells, the inside of the cells become more positive. That is why there is an upward motion for the waves. And then sa phase 1, we have the early fast repolarization. This is just a quick downward movement of the action potential due to the movement outside of the potassium. However, it will plateau since as the potassium goes out, there will also be calcium that will be going inside the cell. And then the repolarization happens if the influx of calcium can no longer balance the number of potassium that goes outside. And then number 4 is diastole, which means that the cell relaxes at that time. There is no movement of our ions. So again, this is our action potential in the heart. Actually, this is also true in our brain. Remember, for the heart, we do ECG. Like merong mga nilalagay kinakabit na mga wire sa ating body, and pagkatapos makukuha natin yung result ng ECG. That is the waves created by the movement of ions in our cell. So the depolarization and repolarization waves are being manifested in our skin surface, and thus we get to see the waves in the ECG. So ECG is again electrocardiogram. However, in the brain, di ba, meron din tayong sa brain pag dito siya nilalagay. We call that EEG. ECG kung sa heart, electrocardiogram, EEG pag sa brain. But actually, the same action potential yan. Therefore, our brain works also with the help of this ions. Okay, EEG is electroencephalogram. That is for the brain. Okay, so do not forget the waves for our normal ECG. We have here the P, the QRS, and the T wave. And then we started with this one. P wave happen if there is atrial depolarization. If the cells in the atrium gets excited, that's the time we get to see the P wave. And then for the QRS, this is the tallest wave that we have. This is being generated by our ventricular muscle depolarization. So it's tall, since remember our ventricles are also larger than our atrium. And then we have the T wave here for the ventricular repolarization. If we have like abnormality in the ECG, that means the patient may experience arrhythmia. Okay, so we ended here last time, no? Itong factors that trigger arrhythmia. So let's move on. with the causes. What are the causes of our arrhythmia? We only have two. Number one, we have abnormal automaticity, and number two, disturbances on impulse conduction. So let's start with the abnormal automaticity. We have here the following factors or conditions that will lead to abnormal automaticity. We have hypokalemia, beta adrenergic receptor stimulation. That's beta 1 receptor. If that's being stimulated all of the time, it can lead to abnormal automaticity. Positive chronotropic drugs can also lead to that. Remember, when you say chronotropic drugs, they can increase our heart rate, just like our beta agonist. So definitely these two are connected. Hindi ko pala siya napalaki. Ayan, these two are connected, beta adrenergic receptor stimulation and positive chronotropic drugs. Also, fiber stretch for our heart muscle. Pag there will be stretching of the heart muscle, and acidosis. What do you mean by abnormal automaticity? Remember, our pacemaker, the SA node, creates an impulse. Okay? Now, our other cells, not just the SA node, other cells in the heart plus are actually capable of producing an impulse. But the impulse that they create is actually very, how do you call that? Very slow, and at the same time very weak, that it does not really cause any effect on the heart. That's the truth about our cells. They are capable of creating an impulse, not just the SA node. However, sa heart, ang kailangan talaga natin si SA node. Now, ang problem nito, if the other cells in the heart can create an impulse that has a higher energy and it's faster, that it affects the heart, it can lead to arrhythmia. So parang may mga cells sa heart na nagfa-fire ng impulse na, remember, supposedly hindi dapat siya magkaroon ng impulse, no? So itong impulse na ito is like stronger. So pag na-create siya, talagang magkakaroon ng movement yon sa heart muscle. Okay? So kaya magkakaroon ng arrhythmia. So that's what you call by abnormal automaticity. So that happens, cells create abnormal impulses because of the following. If you lack potassium, because of the deficiency in the potassium, other cells class may create impulse, or pwede ding baliktad. The sinoatrial node cannot create enough impulse, thus the patient may experience bradycardia. So depende yun siya sa creation of the impulse. But like beta adrenergic receptor, positive chronotropic drugs, the fiber stretch, and the acidosis, this can actually stimulate cells to produce an impulse. So maraming impulse ang na-produce, talagang magiging abnormal ang heart rate. Okay? For hypokalemia, it can be bradycardia since yung formation of the impulse is abnormal. Kulang kasi ng potassium. Okay? Aside from the abnormal automaticity, we have here disturbances in impulse conduction. Okay? So in this case, there is class a normal formation of the impulse. Okay? The electricity where we depend for our heartbeat is actually normal. However, the problem here is there is blockade in the pathway where the impulse moves. So what are the examples we have here? AV nodal block. Remember, from the sinoatrial node impulse, the impulse created will be moving into the AV node. Therefore, if you have a blockade there, it can really cause arrhythmia. The heart rate, the normal heart rate will be disturbed. And also, blocks on the other pathway, no, diba? After the AV node, the impulse will go to the AV bundle and the Purkinje fibers. So any blockade there can cause arrhythmia. Okay, so actually we have the so-called re-entry or circus movement. So remember, ganito. Our sinoatrial node is located somewhere here in the right atrium. And then again, the impulse is being transferred here in the AV node. Now, if there is a blockade there, magkakaroon ng re-entry. So babalik yung impulse, iikot-ikot lang talaga siya dyan sa AV node kasi hindi siya makadiretso dito sa mga bundles, sa AV bundles and even sa Purkinje fiber. So that's what we call circus movement or re-entry. This can really cause arrhythmia. Why? Nandyan lang siya palagi. So definitely, dito lang din na part yung magkakaroon ng contraction, ng beating. Hindi na siya nakaabot dito sa ating ventricles. So this is one example of a disturbance in the impulse conduction, the re-entry or the circus movement. So ano yung mga blocks na ito along the pathway of the impulse? Pwede siyang presence of an obstacle, pwede siyang either anatomic or physiologic. Okay? So for example, pinanganak ang person na may butas ang heart, pwede yon. That is class A, an obstacle. Hindi makakadiretso yung impulse kasi nga may butas doon. Pwede yun siya. Or pwede din siyang physiologic. Complete ang parts ng heart, wala namang butas, pero the tissues are not working properly. Okay? So that becomes an obstacle also. So again, that will affect the movement of the impulse to the fibers of the heart, leading to an abnormal heart rate. Okay, so pwedeng may mga blockades somewhere in the circuit. Pwedeng unidirectional block, as long as there is a blockade in the circuit class, magkakaroon ng problema, magkakaroon ng arrhythmia. So the conduction class may die down, mamamatay yung impulse, no? Kaya hindi na siya nakadaan, mamamatay na lang siya. Hindi mo na siya magagamit with the fibers of your heart. Okay? Meron ding cases na since there is a problem with the tissue of the heart or the bundles or the fibers, paglabas ng isang impulse, nakaka-pass on siya pero it is slowed down. Okay? So mahina yung pag-pass on ng electricity nung impulse. So hindi pa siya nakaabot doon sa fibers. Nag-fire na ng another impulse yung sinoatrial node. So bale, magdodoble na siya, no? Magkakaroon ng retrograde impulse, and that can also affect the heart rate, the beating of the heart. Therefore, that will also result to arrhythmia. Okay, so all these things can either be anatomic or physiologic. Anatomic means there is really something wrong in the anatomy of the heart, just like sa mga cases ng may mga buslot ang heart, no? Or physiologic. May problem tayo with the functioning of the tissues or the cells of the heart. Okay? So, ito na yung pathophysiology of arrhythmia. So, dalawang causes natin, ha? Pwedeng may obstacle and pwedeng doon sa formation of the impulse. May problema tayo with our sinoatrial node or there are cells na nag-abnormal firing. Okay? Now, let us move on to the types of arrhythmia. Okay? So, ito yung dinadiagnose ng doctor after the ECG. They will be looking at the results of the ECG, and from that, they may classify arrhythmia. They may actually identify arrhythmia. Okay, pinakita ko sa inyo yung normal na ECG last time. This one is our normal ECG. As you can see, wait lang, ha? We have here the P waves. Kasunod lang na siya, ha, ulit-ulit. P waves, the QRS, and the T waves. And they have the same distance all throughout the result of the ECG. Now let's look at the types of arrhythmia. What happened to their ECG results? We have here atrial fibrillation. Take note, atrial, meaning it's on the atrium. There is fibrillation. When you say fibrillation, there is abnormal na heart rate. Okay? It's different from tachycardia and bradycardia. Tachycardia is more than 100 beats per minute. Bradycardia is lower. That's lower than 60 beats per minute. But when you say fibrillation, there is really abnormal heart rate. Pwede siyang magpaspas, pwede po siya mag-slow down. Okay? Now, what happened to a person with atrial fibrillation? There is abnormal firing in the atrium. Okay? So, ito yung magiging result ng ECG. As you can see, there is really no visible P waves. Hindi mo na ma-identify saan yung P waves dyan. Okay? And at the same time, there is irregular RR intervals. RR means the QRS. This one to the next QRS wave. Okay? So, as you can see, we have here a different distances between our RR waves. Si P wave yung before sa QRS. Diba remember, this is the QRS here. Before niyan, dito, dyan mo makikita si P wave. Pero as you can see, there is no really definite na P wave. Walang definite na P wave dito before siya nag-QRS. So, mahirap itong ating atrial fibrillation. Kung balikan natin yung normal, look at the normal ECG again. Here is the normal. You will really see right before the QRS wave, you can really see the P wave. And then after the QRS, you have a definite P wave also. Now again, what happened to atrial fibrillation? There is no definite P wave, and you have a different distances between our QRS, ating QRS intervals. The T waves may be there, though it is not really that definite also, but for P waves, hindi mo talaga siya makikita. Kasi that should be right before the QRS wave. Okay? So, ano yung magiging problem of a person who is experiencing atrial fibrillation? So since there is an abnormal heartbeat, the patient may also experience anxiety and syempre palpitations. And because the beating of the heart is abnormal, the patient will also be at risk of having heart failure. Masisira yung heart kasi nga hindi nagiging synchronized yung beating niya with the atrium and even the ventricle. Hindi na sila synchronized yung movement. Okay? And then there will also be risk of cardiac thrombus and embolism that may lead to stroke. Okay? So since the beating of the atrium class is not really normal, that also means the movement of the heart, the blood is also not normal. Hindi masyadong makaka-flow ang dugo. Kaya nagpataka na lang beat ang heart. So remember, the blood class, if hindi yan siya nagfo-flow, it may lead to clotting. Okay? Remember, thrombus and embolus are two types of clots. And if there is clot formation, that may lead to stroke. Kasi mag-plug yan siya doon sa blood vessel. Okay? Hindi na makaka-flow ang blood. Okay? Sige. So before I'm going to answer that question, ako muna. What's the difference between a thrombus and an embolus? These are two types of clot. Okay, blood clot. But what's the difference between thrombus and embolus? Taong may anxiety can have heart problems po. The anxiety is because of, syempre, it's mental health issue. However, since your brain is always active, there is like firing of neurotransmitters also in the brain, abnormal firing, may effect talaga siya sa heart. Okay? Kasi pag may anxiety ka, mataas yung level ng norepinephrine mo. And remember, pag mataas ang level ng norepinephrine mo, may corresponding activity yun siya sa mga receptors. And isa na doon yung nagkaroon siya ng activity with the beta-1 receptor that can increase heart rate, conductance velocity, and even force of contraction. So definitely pwedeng maapektuhan, okay, if left untreated. Okay, so what's my question again? Okay, sige. So ganito yung ano ha, hindi ka na siya sa Google yung answer. Ay, ano to? Naulit ang akong gibasa. I reached the end pala. Hindi ka sa Google. Naintindihan niyo yung binasa niyo sa Google. Class, when you say thrombus, it's a clot formed, example, in the blood vessel, and it stays there. Okay? Kung saan siya na-form, magsistay siya dyan. Okay, that's a thrombus. So for example, na-form siya in a blood vessel in your brain, magsistay lang siya dyan. And it will clog the blood vessel, leading to the decrease in the blood flow. Thus the person may experience stroke. Okay? Stroke is, kulang ng oxygen yung brain mo kasi hindi na naka-flow yung dugo. Okay, that's stroke. Now, pag sinabing embolus, this is a traveling clot. That's their only difference. The one stays where it is formed, that's thrombus, and embolus class is a traveling clot. Therefore, like it is produced somewhere, but it travels in the body until it reaches a very small blood vessel and it clogs there. Magiging obstacle na siya doon. Maungot na siya dito sa gamay na blood vessel. And it may also cause stroke. Depende kung saan siya napunta and saan siya nag-cause ng clogging or blockade. But anyway, both are clots. I hope that is clear. Ha? Sige. So do not forget how when you say stroke, that is a condition wherein there will be lack in the supply of blood and syempre oxygen in their brain because of the blockade in the flow of blood. Kasi mostly the clotting happens in the blood vessel of the brain. Okay? Pwedeng ganun yung nangyari kaya siya nag-stroke. Iba yun siya sa myocardial infarction, yung sa heart attack na tinatawag natin. Kasi the blockade is in the coronary arteries, in our heart na blood vessels. That's the difference between a stroke and a myocardial infarction. Okay? So aneurysm is another condition. Sa aneurysm naman, the problem is like the blood vessel. It gets too weak. May mga parts sa blood vessel class na magiging very soft siya. Kasi supposedly, di ba, our blood vessels are strong enough to withstand the blood flow. However, yung sa part ng aneurysm, there will be, again, weakening of the wall of the blood vessel. Thus, it cannot really accommodate the blood flow until pwede siyang mag-burst, okay, because of that weakening. So that will be bloody if magpuputok siya. Okay? So depende na yun kung anong blood vessel yung pumutok. Okay, so that is for atrial fibrillation. How about this? Supraventricular tachycardia. By the way, if you hear the word supraventricular, we are still talking about the atrium here. The atrium. Hindi ito ventricles. Diba we have 4 chambers of the heart, the right and the left atria and the right on the left ventricles. But if you hear the word supraventricular, that is referring to the atrium. So this is on the atrial wall na side, and there is tachycardia. So the patient may experience heart rate that is more than or equal to 180 beats per minute. Remember, our normal heart rate is just 60 to 100. So this is far beyond the normal range. The patient is experiencing tachycardia. And if we're going to look at their ECG, this will be the ECG. You can still see the QRS waves with different length or height, I mean. And wala na, we cannot identify the P waves and even the P waves. Okay? Now, ito naman yung sa ventricular. Ito na yung sa ventricles talaga. Ventricular tachycardia. And meron tayong two types of ventricular tachycardia. Monomorphic. Monomorphic because all the waves look the same. And you cannot identify the P waves, the QRS, and the T waves anymore. Pero magkakapareha sila ng mukha. Okay? So you can see this in like mga palabas, mga anong palabas? Yung mga doctor na genre, medicine na genre na mga palabas. They are going to attach an ECG to the patient. We can see waves like this, meaning there is abnormality in the beating of their heart, especially the ventricles. The patient is experiencing ventricular tachycardia. Pero monomorphic. Ito naman yung polymorphic. Okay? So again, we cannot identify any more the normal waves, the P, the T, and the QRS waves. And actually, the waves do not look the same. So that is why polymorphic siya. Okay? And muna na siyang padulong siya sa flatline. Pag magganito na gani ang patient class, na ganyan na lang siya, waves na lang na magkaiba ang mukha, papuntang flatline na yan. Okay, so this one is the most dangerous, the life-threatening na arrhythmia, as in pinaka-delikado na arrhythmia. The polymorphic arrhythmia, example of this case is the torsades de Poix. Okay? No, the flatline is a flatline. So meaning pag nag-flatline na yan siya class, wala na. Di ba remember, ECG is the body surface manifestation of this repolarization and depolarization waves that happen in the cell. There is movement of our ions. So meaning pag nag-flatline yan siya, patay ang patient. Wala nang movement. The ions are not moving anymore. There's no impulse. There's no heart rate. Kung walang impulse, walang heartbeat. Okay? So kaya siya nagpa-flatline. Okay? So flatline is neither. Walang wave kang makikita dyan kasi wala na ngang movement kasi patay na ang patient. Okay? Now, if for example, the patient experiences flatline, meaning niya nag-stop na yung kanyang heart ng pag-beat, pero kung ni-revive nila tapos biglang nagkaroon ng ganito, meaning yan nag-beat ulit yung heart nila. Okay? Pero kapag ganito pa yung beating ng heart, the patient is not yet stable. The beating of the heart is not yet stable. We need to achieve the normal ECG. Okay? Since this is polymorphic na, anong tawag sa kanya? Ventricular tachycardia. Again, example is torsades de Poix. So yun yung mga examples class of arrhythmia. Okay, any question before we'll move on to the drugs? Kasi sa pharma naman, we don't really concentrate on the diagnosis. It's just good that we have background information about the condition, but we concentrate more sa mga drugs natin. So before let's discuss antiarrhythmic agents. Any question about the pathophysiology of arrhythmia? Wala na? Sure. Sure na yun. Let me look at the time. Sandali. Wala. Sige. So, let's talk about the agents for our arrhythmia. What's our aim? Why do we need to give our patient these drugs? Syempre, that is to cure arrhythmia. And how? Our aim here is to first reduce ectopic pacemaker activity. What do you mean by ectopic? Ibig sabihin ng ectopic, ectopic pregnancy, ectopic pacemaker activity. Yeah, abnormal. Kung sa pregnancy, yun just sa tube, yun siya nagtubo. Yeah, pero parang ano, yeah, ang fetus. Pero pag ectopic pacemaker activity, that means the activity of the sinoatrial node is abnormal. Pwede siyang magkaroon ng premature na like heart contraction because of the premature impulse also. Okay? So, or kaya mabilis mag-produce ng impulse yung sinoatrial node, anything abnormal. Okay? So that's what we are reducing when we give drugs for arrhythmia. Or we modify conduction or refractoriness in re-entry circuits to disable circus movement. So, pwedeng ganun din. Depende kasi sa arrhythmia ng patient. Diba? I told you a while ago na the other cells of our heart they are also capable of producing impulses. We call them abnormal impulses. Therefore, we are trying to suppress that and we are trying to block the movement of these abnormal impulses. Okay? Especially the re-entry circuits kasi the flow of the electricity of the heart should follow the phases I told you last time. Pero since merong mga abnormal, kahit saan na lang napupunta yung impulse, nagpabalik-balik, ayun yung binablock natin using these agents. Okay? Sige. So we have 4 major mechanism of action of our anti-arrhythmic drugs. Meron lang din tayong 4 classes of anti-arrhythmic drugs. So nakapasunod na ito ha. This is the mechanism of action of the class 1 anti-arrhythmic drugs. They are sodium channel blockers. This is the major mechanism of action of our class 2 anti-arrhythmic drugs. Blockade of sympathetic autonomic effects in the heart. And then 3 is prolongation of the effective refractory period. We'll talk about more of this later. And lastly, we have 4, the blockade of the calcium channel. So definitely this is referring to our calcium channel blockers. Okay? Sige. Wait ha. Before natin sila isa-isahin class sa specific anti-arrhythmic agents, dito muna tayo. Nasa end kasi ng slide ko yung parang summary ng ating anti-arrhythmic agents. Here. Okay, this is how we are going to recall our anti-arrhythmic drugs. So I told you we only have 4 classes of anti-arrhythmic agents. So that's from class 1 to class 4. However, for class 1, we have like 3 sub-classifications. So we'll call it class 1A, 1B, and 1C. So sabi ko kanina, all class 1 anti-arrhythmic agents block the sodium channel. Remember, the action potential starts with sodium influx sa cell. Okay? Ay. Saan na napunta? Okay. Again, the action potential starts with the movement of the sodium going inside the cell. So the cell becomes excited, it becomes more positive. So we are going to block that one. Kasi in the case of an arrhythmia that is very active, especially for patients experiencing like tachycardia, masyadong maraming impulse kasi parating na-excite yung cell. So ibablock natin yan with our class 1 anti-arrhythmic agents. By the way, ano lang ito ha, parang mnemonics na ginagamit ng mga nag-aaral ng anti-arrhythmic agents. So class 1A, we have 1 double quarter pounder. Pagkaon na itong istoryahan dinhi, para lang yun matandaan ang ating anti-arrhythmic agent. So class 1A is double quarter pounder. We have 3 drugs there, disopyramide, quinidine, and procainamide. So I'm not that sure if you're very familiar with these drugs though, but let's try to remember them. All 3 belong to class 1A. So that's double quarter pounder. Tapos, pero nag-order ni sa McDo. Ang class 1B, with lettuce, mayo, and tomato, we also have 3 there. So L is lidocaine, M is mexilitine, and T is tucainide. Okay, and then class 1C and more fries, please. We also have 3 there. MO or more is moricizine, and then you have the flecainide and the propafenone. So again, you may use these mnemonics for you to easily recognize and remember our class 1 anti-arrhythmic agents. Because they are not really that common, except for lidocaine though. I believe you're very familiar with that. Wait lang. Murag malubat na siya. Okay, and then our class 2, take note, class 2 are all beta blockers. Okay? Beta blockers lang talaga lahat ang ating class 2 anti-arrhythmic drugs. So definitely beta blockers are very useful. We learned that we use that for hypertension, and then for heart failure, and now beta blockers are also used for arrhythmia. And then the class 3, that's how they remember. So am I at class 3 already. So am I kasi we have sotalol and amiodarone. Okay? Brand name ng amiodarone in the market. I think that's cordarone. I don't know if you have encountered that drug. Okay? And for class 4, yung class 4, tandaan nyo lang talaga calcium channel blockers ito. Okay? Again, they are our calcium channel blockers. Most especially our non-dihydropyridines, we have the verapamil and diltiazem. So remember when we discussed the calcium channel blockers used for heart failure and at the same time hypertension, we discussed there that our dihydropyridines, those that end with dipine like amlodipine, are selective on the calcium channels in the blood vessels. Okay, so definitely they are more used for conditions sa arteries or sa veins, sa blood vessels. So more on the sa hypertension side. However, the non-dihydropyridines, verapamil and diltiazem, are more selective to the calcium channels found in the heart. So they block the calcium channels there in the heart. So definitely we'll be using this too on heart conditions like arrhythmia. Okay, questions so far? Before tayo mag-continue, you can use this one ha, you can use this one to easily remember our drugs for arrhythmia. Okay, if you don't have questions, let's go back. Let's talk about the specific anti-arrhythmic drugs. Okay, again, starting with our class 1. Take note when I ask you what is the mechanism of action of our class 1 anti-arrhythmic drugs. They block the sodium channel. If they block the sodium channel, definitely sodium cannot enter the cell and we will have slowing down of our action potential. Magsuslow down talaga kasi remember, action potential starts with it. Remember, the phase 0 is depolarization. And if we look at it, there is entrance of sodium inside the cell. So we are going to block that for us not to create abnormal impulses or for us not to create fast impulses in the heart. Okay, so class 1A, They are the drugs that still blocks the sodium channel but prolongs the action potential. Okay, mapoprolong yung action potential kasi kulang yung sodium kasi hindi siya nakakapasok inside the cell. Okay? Ano nga yung ating mnemonics here? Double quarter pounder. Baliktad lang. DQP. Double quarter pounder. Disopyramide, quinidine, and procainamide. So, if we're going to use these drugs, example, procainamide, again, there will be slowing down of the conduction velocity and the pacemaker rate. Hihina yung pag-produce ng impulse kasi nga binlock natin si sodium. So, there will be prolongation of the action potential duration and magdi-dissociate yung magdi-dissociate siya from the sodium. Nawala ko yun. Okay. So what are the clinical applications now of our procainamide? Most of the time we use this for atrial and ventricular arrhythmias. So that's both types of arrhythmias, whether it's on the ventricles or in the atrium. Okay. And they are second line drug for our most sustained ventricular arrhythmias associated with acute myocardial infarction. Okay, if the patient experiences acute myocardial infarction and then because of the myocardial infarction, the patient also experiences arrhythmia. Magiging second line lang siya ha. Second line lang, hindi yung pinakauna talaga nating inibigay. Okay? Wait lang. So for our toxicity, we have here hypotension. This can also lower down the blood pressure. And our number one problem for our drug for arrhythmia is they can also cause arrhythmia. Okay, so like we treat atrial or ventricular arrhythmias, or example, atrial arrhythmia, yung experience ng patient, binigyan mo siya ng procainamide, and then magkakaroon siya ng other type of arrhythmia. Okay, for example, this one, QT interval prolongation or the induction of the torsades de poix. Remember, this is our most dangerous type of arrhythmia. So, hindi basta-basta yung arrhythmia class na magbibigay ka lang ng drugs. This requires constant monitoring of the patient kasi again, drugs for arrhythmia can also cause arrhythmia. That's our number one problem with them. So, kailangan ng monitoring talaga. We need to constantly adjust the dose for our patient. Kasi pag nasobrahan na, talagang mag-arrhythmia naman siya and ibang klaseng arrhythmia na naman yung kanyang mai-experience. Okay? And long-term therapy can also produce reversible lupus-related symptoms. So, last time when we discussed our antihypertensive agents, meron ding drug doon na nagkakos ng SLE-like symptoms, systemic lupus erythematosus. Ano nga yun? Can you still remember that?
Hydralazine.
Okay, very good. That's hydralazine. So, idagdag niyo ito class sa ating listahan. Actually, may mnemonics tayo dyan. Wait lang. Sulat ko. These are the drugs na nagkukos ng SLE-like symptoms. The patient does not really I have lupus, pero may mga symptoms na resembles lupus. Okay? So ito, drug associated. We have P for procainamide, I for isoniazid. Remember, isoniazid is a drug for TB. M is methyl dopa. Let's add methyl dopa. Pero lang kasi yung kanyang percentage of causing this reversible lupus related symptoms medyo mababa lang, so that is not really common. Yung talagang common yung hydralazine and even the procainamide. C is nakalimutan ko. Is C. Oh, yan yung C ha, hydralazine. I forget the C. Ano nga yun? What's the letters? Alam ko na. Ayan. Chlorpromazine, which is a drug for psychosis. Okay. So please take note of this. This one, these are the drugs that can cause reversible lupus-related symptoms. That's our mnemonics, PIMCH. Okay? Sige. So quinidine is a cinchona alkaloid, which has the same effect with that of the procainamide. Thus, they belong to one class, but this is more toxic. So I don't know if you have learned this one in your pharmacognosy. Again, this is from cinchona bark. This is an alkaloid. So again, this is an alkaloid. So definitely this is naturally occurring. Ano nga yung scientific name ng cinchona? Who can still remember? Picog. Ano mo picog, di ba? You discussed alkaloids, right? So included sa pag-discuss ng alkaloids itong cinchona bark. Kasi ito talaga yung kinukunan natin ng alkaloid na merong pharmacological activity. We have two types of cinchona. The yellow cinchona and the red cinchona. Cinchona soxyrubra. Siyempre, rubra is red. So definitely this is the red cinchona and the cinchona calisaya. This is the yellow one. Okay, so please take note of that. And what are the alkaloids na makukuha natin dito? We have the quinine and the quinidine. Are you familiar with quinine? Since you are done with your microbio and your Pharm Chem 2, I am actually assuming here that you are familiar with this. And this one is also discussed in pharmacognosy. So nag-assume ko din hinga kaila mo sa ila. Choppy? Mahina siguro yung internet connection. Again, anything that you know about our cinchona alkaloids? We only have two here. Actually, may cinchonine pa siya pero it's not really used as drug. So ito talaga yung dalawang ginagamit. Paulit-ulit kasi itong quinine na didiscuss sa PCOG, sa micro, sa Pharm Chem 2. Dinidiscuss ito. So anything that you know, ay nag-absent mo ato talaman kung gidiscuss na siya. Wala. Para sa ato ang quinine, i-google na lang na ninyo, B, kung nakalimot na mo.
Sa ano, ma'am, diarrhea po.
Sa diarrhea, this one is used for malaria. Okay. Another question. What agent causes malaria? Ano nag-cause ng malaria? Anong pangalan? Okay, very good. We have here the Plasmodium species. May hindi siya kalimtik class kay mag-board exam para mo. And appeal niya siya sa board exam. Remember, not just falciparum, how we have 4 types of Plasmodium. The falciparum is the most common one. Yung pinaka nagko-cause ng malaria talaga. And parang strongest among them. Pero yan ang common, falciparum. But other types of Plasmodium that can cause malaria also, we have the Plasmodium ovale, Plasmodium malariae, and Plasmodium vivax. So do not forget that. And quinine is one anti-malaria. The struggle is real. Okay, again, we have here the quinine as anti-malarial drug. And please take note that quinidine is still a cinchona alkaloid, but this time it is used as a drug for arrhythmia. Okay? Hindi siya ginagamit for malaria. And nasa class 1A siya. It has the same activity with that of procainamide, but this is more toxic. They are the same that they can cause torsades de pois. May S yan siya. Torsades de pois. And aside from that, since this is a cinchona alkaloid, it can cause synchronism. Okay? This is what you call the condition if you are overdosed or nagkaroon ng toxicity with cinchona alkaloids, synchronism. So, ano yung magiging signs and symptoms? We have headache, dizziness, and we have the tinnitus. Remember when you say tinnitus, that's ringing in the ear. Okay? Have you experienced that one? Mag-ring imuhang ear, wag na nagabagting. Kaya ako pag, like example, nag-migraine ako or I'm not feeling well, nag-ring ang ako ang dalunggan, we call that tinnitus. Yeah, kung stress ka, you can also experience this one. Pero there are really people na nagkaka-tinnitus and nagli-lead siya into losing their hearing, sense of hearing. Okay? Sige. So kanina ko pa sinasabi ang torsades de pois. Torsades de pois is an example of a polymorphic ventricular tachycardia. So remember the waves there that that are different from each other, and you can no longer identify the P, the QRS, and the T waves. Okay, so there are like twisting of all the waves, especially the QRS complex along the isoelectric line sa gitna. Magkakaroon ng twisting dyan, hindi mo na siya maintindihan yung ECG. So ito yung most dangerous form of arrhythmia, and this can actually lead to a flat line. So the ECG may look like this. These are all torsades de pois. Okay? Iba-iba yung mukha ng waves. Okay. So yun yung kinukos ng ating type class 1 antiarrhythmic agents. They are drugs for arrhythmia, but they can cause arrhythmia also. Disopyramide is another one. Remember, double quarter pounder tayo dito. The effect of this one is still similar to that of the procainamide, but my internet connection is unstable, so I believe mag-choppy sad ko. Okay, but what is different here? Si quinidine, it's more on synchronism, but this time si disopyramide, meron siyang anti-muscarinic activity. So remember, when you say muscarinic activity, we are talking about acetylcholine. That's dumbbells. But since this is anti-muscarinic effect, therefore you have to reverse the dumbbells, and you can picture out what will happen to the patient. Okay? So i-reverse mo yung sabot sa internet connection during dapita sa world. Ngano ko sige kawala. Anyway, asa na end ang akong gina-discuss. May moderation ako. Again, disopyramide ha, meron siyang anti-muscarinic activity. Again, reverse the dumbbells, reverse the diarrhea. That means constipation. Okay, U is urination, so the patient may experience urinary retention. B is bradycardia, so the patient may experience tachycardia. Okay, baliktad. Tachycardia siya. Therefore, it may precipitate heart failure. So you reverse other parts sa dumbbells na lang. That's the anti-muscarinic activity. So this is actually it. Urinary retention, dry mouth, blurred vision, constipation, and since it can cause mydriasis kasi M for meiosis, M for dumbbells is meiosis, right? So the reverse of that is mydriasis. There will be dilation of the pupils, so it can worsen pre-existing glaucoma. It cannot cause glaucoma though, but it can worsen the glaucoma if meron ng glaucoma ang patient. Okay, any question about our class 1A antiarrhythmic agents? Wala. So let's move on to our class 1B. This time, they will block the sodium channel still, but this time they will shorten the action potential. Si class 1A, mapoprolong si action potential. Hahaba yung kanyang duration. Okay, doon sa action potential natin. This time, the action potential will be shortened. So lettuce, mayo, and tomato lang yun, no? Pero let us include also the phenytoin. Okay? Kasama siya dito. Lidocaine, phenytoin, tocanide, and mexiletine. So among them, maybe you are very familiar with lidocaine since this is already discussed sa inyo. This is a local anesthetic. We have here the brand name Xylocaine. That's the original use of the drug. It is a local anesthetic. However, for some reason, it can also block the calcium channel involved in the action potential. Okay? So this one is very useful in arrhythmia, especially that it has low incidence of causing toxicity and very effective siya, especially for arrhythmias which are associated with myocardial infarction. Okay, kung nag-heart attack ang patient, for example, and then the patient develops arrhythmia, lidocaine is very effective. However, our problem with lidocaine is we cannot give this orally. This is always given intravenously. Okay, so what are the clinical applications of our lidocaine? We have here termination of ventricular tachycardia, and pwede niyang ma-prevent yung pagkakaroon ng ventricular fibrillation of the patient after cardioversion. So remember, this is associated, this is very effective doon sa mga nag-myocardial infarction, tapos merong nagkaroon ng arrhythmia. Okay? So ito yung gamit ng ating lidocaine. And by the way, this is our drug of choice for digitalis-induced arrhythmia. Okay, our digoxin. But remember, our digoxin is used for heart failure. Our problem with that, the life-threatening toxic activity of our digoxin is arrhythmia. So our drug of choice for that is lidocaine. If we don't have lidocaine, then we may use phenytoin. That's the second line drug for digitalis-induced arrhythmia. Now, since this is class a local anesthetic, definitely the toxicity will be more on neurologic, okay? So the patient may experience nystagmus. What do you mean by nystagmus? By the way, any idea what nystagmus is? Before time mag-end. Sikog kaputol ba? Pangit kayong connection. Wala. Nystagmus class is dancing eyeballs. Sa eyes. Very good, yeah. Again, nystagmus is dancing eyeballs. Have you seen a person na nag-move yung kanyang eyeballs? Pag mag-stay lang siya, ganyan. Involuntarily. Yeah. Yeah, there is uncontrolled movement sa eye. So that is why we call it dancing eyeballs. We call that nystagmus. That's the medical term. Okay? And then paresthesia, that's tingling sensation sa mga nerves, especially sa periphery. And then tremor, nausea of central origin. So it's from the brain, lightheadedness, hearing disturbances, slurred speech, and if grabe na talagang dose ng lidocaine ang binigay sa'yo, it can cause convulsion, okay? Shaking of the body because of the abnormal firing of the neurons. So definitely all of this are neurologic symptoms. Okay? Siguro I'll just end here with mexilitin para konti na lang i-discuss natin on Wednesday. Tapos after ko i-discuss ito on Wednesday, we will have our pre-test sa anti-angina drug before ako mag-start sa anti-angina. Okay, so we have Mexitil, which is an orally active congener of our lidocaine. Okay, so lidocaine device given intravenously. So we have here another drug which is derived from lidocaine, but this time we can give the drug orally. Okay, hindi na siya basta-bastang masisira even if it will pass through sa stomach acid and sa ating other parts of the gastrointestinal tract. Now, since this is derived from lidocaine, definitely it has the same activity with that of lidocaine. It has the same clinical application. But just like our lidocaine, we have an off-label use here. Though sa lidocaine, talagang yun talaga ang gamit niya, ha? Local anesthetic. Ito off-label. What do you mean by off-label? Hindi mo makikita, hindi mo makikita sa kanyang label talaga, sa mga inserts, information, official information about the drug, that's off-label use. So since it is derived from lidocaine, which is a local anesthetic, definitely this has an effect also in the neurons. So paano siya ginagamit off-label? Ginagamit siya in treating chronic pain. So example of the chronic pain na ginagamitan ng mexilitin, it's diabetic neuropathy and yung mga nerve injury. Okay, off-label use niya lang yan. You cannot see that in the package inserts or sa mga monograph about mexilitin. Okay, so kagaya din ng lidocaine, this one has neurologic signs of toxicity also. You have tremor, blurred vision, and lethargy. That's a feeling of like weakness, fatigue, ganon. Okay, so next meeting, we will discuss class 1C, class 2, 3, and 4. But we will not really dig deeper into class 2 and class 4, the beta blockers and the calcium channel blockers, since we are done with them. They have the same mechanism of action. Kung ano yung mechanism of action nila for hypertension and for heart failure, ay, yun pa rin naman ang gamit nila, ang mechanism of action nila sa arrhythmia. Okay, nagaputol-putol na jud ko dili na jud makaya ang internet. Okay, do you have questions?